30 years ago, the poliovirus was rampant in more than 120 countries, responsible for the paralysis of about 350,000 people each year. Today, there are only 12 documented cases of the disease in just 2 nations, and, according to the Bill and Melinda Gates Foundation, this once-prevalent illness may be wiped off the face of the planet by the end of 2017. Speaking at Rotary International's World Polio Day event on Tuesday, which was co-hosted by the Gates Foundation, Dr. J. Wenger, the director of the foundation's polio eradication program, said humanity had successfully reached the endgame of polio eradication. "We are closer than ever, and we're optimistic that we can see the end of wild poliovirus disease by as early as this year," Wenger said, according to CNBC. To mark World Polio Day, Rotary International and the Gates Foundation roped in WWE star John Cena to spread the word about polio eradication efforts. Rotary and the Gates Foundation have both contributed enormously to the global fight to eradicate polio, which has centered primarily on the dissemination of safe and effective oral vaccines to even the most remote corners of the globe. The Gates Foundation has invested almost $3 billion in this effort, a spokeswoman told CNBC. Rotary, which launched the world's first global initiative to end polio in 1985, has contributed nearly $2 billion. With the support of governments and other organizations, the Gates Foundation and Rotary have helped vaccinate 2.5 billion children in 122 countries since the 1980s. Subscribe to the Lifestyle email. Life hacks and juicy stories to get you through the week. We've gone from 40 cases an hour back in 1988 to just 40 cases in all of 2016, Bill Gates, the co-founder of Microsoft, said in June. When India announced in 2014 that it was polio-free, Bill Gates wrote in a Hindustan Times op-ed that the country's success in eradicating polio is the greatest global health achievement I have ever witnessed. India may be the hardest planet to vaccinate every child. The country has some of the most densely populated urban areas in the world, making it a challenge to track children polio workers have immunized, Gates said. But India was up to the challenge with more than 2 million vaccinators reaching more than 170 million children with the vaccine. Today, the crippling and potentially fatal disease survives only in Afghanistan and Pakistan. Both nations have committed to fighting the virus. In this year's Gates Foundation annual letter published in February, Gates echoed Wenger's comments in saying that the end of polio was within sight. "It's thrilling to be nearing the day when no children will be crippled by polio," he wrote. "We're often asked why we're making such a big effort on polio if our priority is to save lives. The answer is, ending polio will save lives through the magic of zero. When polio is eradicated, the world can dedicate polio funds to improving child health, and the lessons from polio will lead to better immunization systems for other diseases." He said he envisions a future in which malaria will be no more and no one will die from AIDS. Few people will get tuberculosis. Children everywhere will be well nourished. And the death of a child in the developing world will be just as rare as the death of a child in the rich world, Gates wrote. "We can't put a date on these events, and we don't know the sequence, but we're confident of one thing: the future will surprise the pessimists."